More than 100,000 staff and residents in Florida's long-term care facilities have been tested for the coronavirus. That's according to the state's latest numbers. Patrick.
That's right, Jane. But as Governor DeSantis' administration touts that number of completed tests, 4 in Your Corner investigative reporter Katie LaGrone found out there's a key aspect of testing the state is not keeping tabs on or telling you about, which some say could raise your personal risk of getting sick from the virus.
Since the beginning, the elderly in Florida's long-term care centers have remained COVID-19's target number 1, with more than half of COVID deaths in our state linked to these facilities.
You also have an environment where the virus can spread rapidly.
Following a federal directive last month that every resident and worker in a long-term care center be tested for the virus, Florida is now trying to make that happen within 2 weeks. More than 100,000 tests completed so far, roughly 30%. But we've discovered while workers in these facilities are required to undergo testing for the virus, residents are not.
Why not make it mandatory for residents?
That's a question you need to ask the Department of Health.
We've also discovered across the state, no one is keeping tabs on residents who refuse testing.
You're right. There's not a state tracking system at this point for residents who refuse.
Kristen Knapp is communications director for the state's Healthcare Association, which represents nearly 600 long-term care facilities.
Isn't this information important to have? Who's refusing?
Well, I think any information we have about testing is important because it does help us make clinical decisions. It does help us make staffing decisions.
Knapp says residents who object have that right, but are monitored for signs and symptoms and wear masks when being treated by staff. Around the country, tracking residents who refuse testing is spotty. Maryland does it. Pennsylvania says it will in the near future. And New York would only tell us in some cases residents have refused.
That's terrible. It needs to be tracked.
Terry McGuire has a personal stake. Her mother lived in a nursing home on Florida's West Coast and last month tested positive for the virus after a second visit to a hospital.
She knew I was there.
10 days later, Terry's 87-year-old mother died. The county medical examiner confirming her death caused by complications of COVID-19. This is a picture of Terry talking to her mom one last time.
We were singing the song, her favorite song of You Are My Sunshine.
While Terry doesn't know where her mom picked up the virus, she believes everyone in a nursing home should be tested. And those who say no, tracked.
I don't think that's fair for either staff or the residents there.
We've asked the Department of Health why resident testing isn't mandatory and why no one's tracking those residents who refuse testing. Despite several emails to its spokespeople, we have yet to get any answers back. Katie LaGrone, Fox 4 in Your Corner.
Thanks, Katie. And the state is working to get all 355,000 residents and staff in these care centers to be tested for the coronavirus within 2 weeks. So far, again, they have only tested just about 30%.